Good morning. This is Follow the Science Monday COVID-19 update. I'm Dr. Paul Juarez, professor and vice chair for research in the Department of Family and Community Medicine at Mary Medical College. I'm also principal investigator of the Tennessee Community Engaged Alliance Against COVID-19, also known as Tennessee CEAL, and site PI for HealthWorks, a HRSA-funded COVID prevention program through a subaward with the Morehouse School of Medicine. Today is Monday, April 23rd, 2023. Nationally, newly reported cases of COVID-19 are down 26% over the past 7 days, from 20,000 per day to about 14,500 per day. And test positivity is down from 6% to 5.9%. Hospitalizations also are down by 13% to under 5,000 per day, while deaths are down 36% from 255 to 195 per day. Likewise, declines in Tennessee over the past week show that the number of newly reported cases and hospitalizations and deaths also continue to decline over the past week. New reported cases of COVID-19 in Tennessee were down slightly from 425 to 414 per day, or a rate of 7.6 per 100,000 of the population. Hospitalizations were roughly the same as at 50 per day as previously, and daily number of deaths remains around 4 per day. All counties in Tennessee continue to be in the CDC's green zone for community spread. However, Tennessee ranks 46 among the 50 states for the percent of the state's population that has had the bivalent booster, standing at about 10%. The low rate of booster uptake remains a concern, as it suggests that a large percent of the population may be at risk for future variants. In other news, the CDC announced a series of changes to its COVID-19 vaccine recommendations. These changes include: 1. Everyone 6 years of age and older who has not received a bivalent vaccine dose should receive one, either Pfizer or Moderna, regardless of what vaccine was used for their primary series. 2. Those who have already received a bivalent vaccine booster do not need to take any action unless they are 65 years of age or older or immunocompromised. 3. Adults 65 years of age and older can now receive a second bivalent booster dose at least 4 months after their initial bivalent dose. 4. People who are immunocompromised may receive additional bivalent vaccine booster doses at least 2 months after their previous dose, and should consult their healthcare provider to determine the best timing for additional doses. And 5, bivalent vaccines can now be used for all primary series and booster doses in adults and children 6 months of age and up. The original monovalent booster The original monovalent COVID-19 mRNA COVID-19 vaccine will no longer be recommended for use in the United States. Finally, the subvariant XBB.1.16, also known as Arcturus, is about 20% more infectious than the original Omicron variant, and now accounts for almost 10% of new infections. The good news is doctors don't believe this subvariant is causing more severe disease. However, they are seeing it impact more kids, causing different symptoms than other mutations, including an increase in pink eye and higher fevers. For now, this is Dr. Paul Juarez From Tennessee SEAL and HealthWorks, I'm Harry, wishing you health and wellness. Be safe.